Hello, it's a pleasure to talk today about the GeoHealth community response to the COVID-19 pandemic. My name is Este Geraghty, and I serve as the Chief Medical Officer and Health Solutions Director at ESRI. I've been at ESRI over the last 6 years, serving the global health and human services needs of our world. Today, I'd like to share a wealth of resources with you that support pandemic response, while at the same time demonstrate the power of GIS as a collaboration platform. Everything I'll be talking about is part of the ESRI COVID-19 GIS Hub, and I'm going to spend the next few minutes showing you what's available there. You might want to take a screenshot of the URL, but don't worry, I will show it again at the end. Now, it's worth noting that we continue to update the materials in this site daily, and to make that easier for you, we posted on a banner at the top so you can check back often. And second, we actually are highlighting the fact that you can request GIS assistance whenever you need it. That assistance is provided by our disaster response program, which has been around for more than 20 years. Now, for COVID-19, we're providing software bundles, solutions, services, and technical support at no cost for those who want to take advantage. To date, that number is over 4,000 organizations. Now, the first thing you'll see when you scroll down in the hub is a set of 4 cards. The first card focuses on health, racial, and economic equity data. When you click on Explore, you actually come to 133 data sets that are relevant to this topic. They're all free and geo-enabled so that you can use them in your analyses right away. The next card points to the world-famous Johns Hopkins University dashboard. This single dashboard has been requested billions of times. At its peak, we were seeing over 3.5 million hits per hour. This one dashboard literally changed the world. It inspired countries, states, and cities all over the world to create their own localized dashboards. It informed the world about what's going on. It built an expectation around the world for authoritative and near real-time data, and it promoted the idea of data sharing, since they made their underlying data set available to everyone. I'm excited to show you the next card, which is really a system of systems approach to cataloging the world's GIS applications for COVID-19. This is what it looks like. You can see right away that there are 288 contributed applications here. You can select by country in the alphabetical list, and here we see that Argentina has 9 GIS applications contributed, or you can select a country on the map. So then you can see that we've zoomed into Argentina. We can see all 9 of their applications across the top, and when you click on one, you're going to get a preview of that application that you can start to interact with. Or you can copy the URL or simply open the application in full screen. For anyone that would like to contribute their ArcGIS application to this catalog, it's easy to do. We have a short form for you to complete. Just contact me and I'll send it your way. Now, we have a similar system of systems catalog for the US applications, which currently holds 377 shared resources. The next thing you'll encounter as you explore the ESRI COVID-19 GIS Hub is a compendium of death forecasts, using 11 different expert models collected by the US CDC. You'll also see a US county trends map that looks at the last 14 days, updated daily, to determine where in the pandemic phases each county lies. That goes from emergent to spreading to controlled. I've added a link to a blog that explains the methodology, and it links to the same kind of trends map for every impacted country. As you scroll down the hub site, you'll see that it's organized across 3 broad areas: getting started, getting data, and getting updates. In the Getting Started section, you'll see the 5 steps that we've been recommending responders use to understand COVID-19 and its impact. They are mapping the cases, mapping the spread, looking for vulnerable populations, understanding your capacity and your ability to surge, and communicating with maps. I'm including a link to my blog explaining these steps in detail, as well as my latest blog with the 5 spatial approaches to safely reopening. As a Chief Medical Officer, these steps and approaches really reflect the way that I think about GIS and its utility in a pandemic. In the Get Data section, you'll find lots of open data. On the front page, we share some featured data sets like weather information, sentiment analysis, and social distancing metrics. The social distancing data are actually very interesting and useful. Whether you're looking at community behaviors like you can with the Unicast county-level social distancing grades, or maybe you want more granular block group analysis of the percentage of people staying home versus pre-COVID-19 days. SafeGraph also provides a points of interest data set so that we can see the places where people are congregating more often, like grocery stores, or less, like entertainment venues. Keeping an eye on these data will be critical as leaders start to reopen communities and try to balance the economic health with the public health. The next section in the Hub is the featured story maps, because sometimes we just need more than data and apps. We need a narrative to put things into perspective. The section for getting updates provides both professional and public level information from some of our most authoritative agencies, the World Health Organization, the US CDC, and the European Center for Disease Control and Prevention. I'll also note that ESRI is providing free COVID-19 response packages to ministries of health and Global Outbreak Alert and Response Network partners so that they all have the needed tools for reporting, analysis of cases and deaths, and all of their response activities. And now I'd like to bring your attention in the upper right to the resources page. Here's where you're going to get the tools you'll need, starting with ArcGIS Pro COVID-19 Modeling Toolbox. This has spatial versions of the University of Pennsylvania's CHIME model and the CDC's COVID-19 Surge model. These are both forecasting models to understand the potential impact of cases on our healthcare systems. Here's an example of the CHIME model and two different social distancing scenarios in the state of Florida. Now, with more strict social distancing, you can see the yellow curve is flattened with regard to ventilator needs. However, with lax social distancing, the orange curve shows a likelihood of exceeding current ventilator capacity. And with the maps, we can see which hospitals in the state will be most impacted. This slide is showing how multiple different models can be compared using ArcGIS Insights, which is included in the disaster response packages. Our solutions division has been incredibly busy building the kinds of solutions that people need to be able to respond. Now, the idea is that these are super easy to deploy, easy to use templates, freeing up development and configuration time, which we know nobody has during a crisis. The arrow is showing that there are even more solutions that can be freely downloaded and used right away. And I know we've all learned a lot during this crisis, and the next area of the Hub you'll run into is our documentation of what we've found to be best practices. Again, trying to help people get their jobs done efficiently and effectively. And for technical discussions around COVID-19, we've set up a special GeoNet site to host those conversations. If you've not heard yet of GeoNet, it's like social media for the ESRI community to share, connect, collaborate, and be productive. We've also put together a number of how-to resources that will help to build capacity during this pandemic. There are blogs, videos, and very short, to-the-point tutorial-style lessons. We're all working together to keep ourselves, our community, our nation, and our world healthy, and lots of people want to help. For those that have GIS skills and would like to volunteer their services, we're directing them to the ERISA GIS Corps of Volunteers, and they've been doing great work. I'm showing you two examples. The first in the lower left is their Stories of Coronavirus Loss and Recovery, which is a crowdsourced effort that's meant to make the data more meaningful by sharing the stories of real people who've been impacted. The second example is their COVID-19 testing site locator. Now finally, when things calm down a little and we get to the point of debriefings, after action reports, and examinations of the lessons we've learned, then I think you'll want to look at some more long-term resources to help you get set up with GIS in bluer skies for the next emergency, whether it's a fire, a hurricane, or a public health crisis. So, as promised, here's the URL for the COVID-19 Resource Hub where you can contribute your applications and pull what you want for your local needs. I want to thank you for your attention, and I offer my email address for future contact.